Hello viewers, I am Dr. Meera Raghavan, consultant obstetrician, urogynecologist and robotic surgeon from Apollo Spectra Hospitals, Chennai. Today, for the benefit of our viewers, we are going on an FB Live session about a very interesting topic and very trending one about pre-pregnancy care. What is this about pre-pregnancy care? It is imperative and important that women have good health and well-being even when they are contemplating or planning a pregnancy. A healthy woman becomes a healthy mother and begets a healthy offspring, and further the child's health gets better. In order to have a successful and healthy outcome of a pregnancy, it is important the mother has good health, and it is important to become a good mother with a healthy status that even the adolescent or the woman who is planning a pregnancy remains healthy and optimizes her well-being even before she is planning a future pregnancy. This is what we mean by good pre-pregnancy care. It's important nowadays that none of the pregnancy should go unplanned, because there is no window of opportunity to optimize physical, mental and social well-being of the prospective future mom. So I would advise each and every single woman out there to plan their pregnancy and not get caught up in the tangles of an unplanned pregnancy and its aftermath. For that, it is important to practice proper contraception and spacing methods so women are not caught unaware because of an unplanned pregnancy. Why am I talking about pre-pregnancy care? Nowadays, we see a lot of women suffering from being overweight. Many women have polycystic ovaries. Some of the women have impaired glucose metabolism and can be predisposed to diabetes. Many women have chronic illnesses such as blood pressure, other cardiac issues which could be congenital or sometimes acquired. Nowadays, we see metabolic problems such as high cholesterol, kidney-related issues, prior history of any TB or even COVID infection thanks to the pandemic, or some other chronic illnesses such as epilepsy or autoimmune disorders, arthritis, asthma and allergic reactions. We have to be aware of these conditions and also understand how these conditions could impact pregnancy, or what effect could pregnancy have on these aforementioned conditions. That is the reason we advocate every woman to have what is called pre-pregnancy counseling and adopt a method of adequate and optimized pre-pregnancy care. Let us just now harpen on the general aspects of pre-pregnancy care. All women should maintain good weight, which is the correct weight for their height when they are contemplating pregnancy. A rough guide is a height in centimeter minus 100 should give your appropriate weight. Any deviation above it or below it would be considered not so optimal weight, and we need to strive even before planning a pregnancy to optimize this weight. So balanced diet, adequate exercise, good amount of sleep, proper stress management will all help in optimizing this particular weight. All women contemplating a pregnancy should start taking pre-pregnancy folic acid supplementation. This is available as a vitamin which is required to be in the dosage of 400 micrograms to effectively cause good formation of the embryo. Why folic acid? Folic acid, if present adequately in the supplement or the diet, will enable good and correct formation of the neural tube system of the baby, especially the brain and the spinal cord. Certain women are predisposed to have folate deficiencies and are predisposed to have babies with abnormalities in the brain and spinal cord formation. Who are those? Women who are diabetic, women who have had a child previously with a brain development disorder or a family history of such a disorder, women who are epileptic and are on medications for epilepsy, women who have had chemotherapy and are known to have folate deficiency. Some degree of immunosuppressant medications can also cause these. These are the women who are prone for folate deficiency and are required to take a higher dose of folic acid. So, when we supplement the folic acid, we reduce the risk of developing a baby with neurodevelopmental disorder. That is the importance of folate supplementation in the pre-pregnancy period. Adequate optimization of thyroid levels are also very important. Thyroid hormone is essential for the offspring in the brain development, the maturation of the nervous system, and the IQ development of the baby. If a mother is found to have underactive thyroid, adequate thyroid replacement is necessary so as to prevent the risk of miscarriage or abnormal neural development in the baby. Similarly, women who have diabetes, women who have polycystic ovarian syndrome, family history of diabetes, women who are on steroids who potentially could develop diabetes, women who are overweight should get their sugars checked along with a glucose tolerance test to see if they have a tendency to become diabetic during pregnancy. Why are we worried about this? High levels of sugars can cause miscarriages, can cause abnormalities in the offspring such as cardiovascular abnormalities or brain formation abnormalities. These can severely impact the health of the fetus and can result in preterm labor or serious complications at birth and during pregnancy. We can abate all this by optimizing the sugar levels due to lifestyle interventions like exercise and proper diet management. That is the reason we have to check for diabetes and impaired glucose levels and treat them accordingly. We also have to understand whether the woman has got adequate levels of iron in her body. That is done by a simple check of a full blood count where we can check the iron levels. Many women, nearly about 80% of our women are anemic and become even further anemic due to pregnancy, due to the changes which happen in pregnancy. So, optimization of hemoglobin levels, adequate iron supplementation and increasing the storage of iron is mandatory even before a woman contemplates a pregnancy. Apart from these, there are issues with regards to calcium and vitamin D supplementation which are essential during the pre-pregnancy care and counseling. So, these are the general principles of preconception care and the advice we offer women when they contemplate pregnancy. Moving on to the second part, where we will look at what important vaccines the woman needs to catch up with if she has not had a complete schedule when she was an adolescent, and why is it mandatory to have these vaccines even before she contemplates pregnancy. The most important vaccine is hepatitis B vaccine. These can be transmitted due to a prick of the injections or because of blood transfusion, blood products, and sexually transmitted as well. All women prior to pregnancy should have hepatitis B vaccination so that they're well protected and the offspring is protected as well. We also advocate nowadays the Tdap vaccine which is given during the pregnancy, but prior to that making sure they are adequately vaccinated with HPV vaccine, which is the Gardasil vaccine which is being promoted for the prevention of cervical cancer. It's a nanovalent vaccine which acts against the high-risk human papillomavirus types which are implicated in the causation of cervical cancer. All women before their first sexual contact or at least before the first pregnancy should have the full schedule of the HPV vaccine, which is now given as one dose now and the second dose in 6 months' time, so that they are fully covered for the life and providing immunity against cervical cancer. Ideally, girls beyond the age of 10 and below the age of 26 should have this vaccine. If they have missed this window, it is okay to have it before the first conception, but they continue to have pap smears every 5 years. This offers almost 99% immunization against cervical cancer and is an effective method to allow our women to be free of cervical cancer due to human papillomavirus infection. This is one other step which we try to complete at the pre-pregnancy counseling when women are planning a pregnancy. Adequate contraception is also advised, and maintaining good health is important. When women are on birth control pills, we advise them to check their ultrasound to rule out any gallstones, liver enlargement, as well as liver enzyme estimation, and also check their cholesterol levels. It is important to make sure they do not develop any side effects while they are on the birth control pills. We ask them to reduce weight, check their blood pressure regularly, maintain a balanced diet, and get rid of the gallstones if we find them as part of the screening. Gallstones during pregnancy can be dangerous, causing severe pain, inflammation in the gallbladder, causing the gallbladder to be infected, and also can result in serious consequences such as pancreatitis. So a screening abdominal scan will reveal the presence of gallstones, and we generally advise them to electively deal with it even if they are contemplating pregnancy, so that they do not develop such problems during pregnancy. Women who are at high risk of certain problems are also screened, and preconception counseling offers us that window of opportunity to counsel them adequately and mitigate those risks. Who are these women at high risk? Any woman under the age of 20, women who are above the age of 35, women who have had artificial reproductive techniques and then become pregnant, women who are undergoing IVF treatment, women who are overweight and obese, women who are diabetic or have impaired glucose tolerance, women with kidney problems, women with liver issues, women with thyroid problems, and women with cardiac issues. These are the women who will need adequate preconception counseling, optimization of their health and well-being before we start them on the pregnancy pathway. The window of opportunity during pre-pregnancy care gives us that benefit to alter the medications which they are already on, so that those medications do not cause any adverse effects on the mother's health or the health of the unborn baby. Like for example, when a woman is hypertensive and has had medications to control her blood pressure, there are certain medications which are not allowed to be taken during pregnancy. They can affect the kidney, they can affect the growth of the baby, they can affect the blood flow to the baby. Such medications have to be changed to pregnancy-friendly medications at least 3-4 weeks prior to the woman becoming pregnant. For that, the pre-pregnancy counseling gives us the opportunity to change the medications and allow these women to become pregnant. Anti-epileptics, the medications which are given for convulsions, also need to be altered, because certain medications such as sodium valproate can cause serious adverse effects in the offspring, like neural tube development effects, brain deformities and spinal cord deformities. We convert them into something which is friendly to the unborn fetus and does not produce any adverse effects in the baby. And we can monitor the drug levels of these medications so that the toxicity levels are not reached during pregnancy and the unborn baby or the mother is not exposed to the toxic effects of these medications. Patients who have kidney issues, who have had abnormality in kidney function, need regular monitoring of their kidney functions, their blood pressure, their weight, and also imaging of the kidneys. They have to be advised that there could be a potential derangement of their kidney functions, and if they are not adequately maintained, can tip off the balance and have a deleterious effect on the kidney and can go into dialysis as well. It is important that the family and the woman understands these risks before contemplating pregnancy. Women who have thyroid issues, we increase the dose of the thyroid in the first trimester so as to meet the extra demand from the baby as well as the pregnant status, so that adequate levels are maintained. The thyroid stimulating hormone and the thyroid levels are to be regularly checked every trimester and the dose appropriately titrated according to the same. Women who have other disorders such as autoimmune disorders, say for example arthritis, SLE, they have to be monitored very strictly and with great vigil so that there is no flare up of this particular problem. They will be advised to have regular blood tests and be kept on the surveillance as part of a multidisciplinary team which involves their key obstetrician, their primary physician, the specialist either being a rheumatologist or a nephrologist or even a cardiologist sometimes, and a fetal medicine person who will need to require to monitor the baby regularly and plan adequately for their timing of delivery as well as the place of delivery. Such pregnancies can be quite complicated and require a lot of expertise to ensure good outcome both for the mother as well as the unborn baby. Apart from these, we also need to optimize the health of the mother, not only physically but also look at their mental well-being. Mental health is a big challenge nowadays, and there are lot of mental health issues which women face in particular. It can be either depression, it can be anxiety disorder, it can be psychoaffective disorders, it can be bipolar disorder, can be schizophrenia, so on and so forth. Understanding these disorders, making sure they are on the right medications, optimizing the medications without compromising the mental well-being of the mother, trying to titrate the dosage of the medications, the side effects are minimal, and watchfully monitoring the pregnancy both from the maternal health and mental well-being point of view is mandatory, and this pre-pregnancy counseling offers us the window of opportunity to help us titrate all the medications accordingly. This mental health issue is also under the purview of a multidisciplinary team so as to get the best outcome both for the mother and the offspring without increasing the adverse effects of the medications. So in this talk, we have covered the importance of pre-pregnancy care and pre-pregnancy counseling, right from weight optimization, balanced diet, exercise, as well as folic acid supplementation, and have looked at various disorders which can have an impact on the pregnancy or vice versa. I would urge every single woman out there to plan their pregnancy, make sure the weight is optimized, complete their vaccination schedule, especially the HPV vaccination, take adequate folate supplementation, optimize their sugars, optimize their blood pressure, and seek medical help if they have any chronic conditions or regular medications. And most important, make sure the mental health is also well maintained before they contemplate pregnancy. Domestic violence is something which is never risen or which are never talked about when we discuss pregnancy and well-being of the mother. it is important that women understand that domestic violence, though suffered in silence, can be detrimental to their health, especially during pregnancy, not only to them but also to the unborn offspring. So I would urge every single woman out there who have suffered in silence with domestic violence to make appropriate step to stop them becoming vulnerable and rise against domestic violence, seek help and protect themselves from the aftermath of the domestic violence. Thank you.